What do you do about incontinence in your loved one, and why is it so important to address this? This is Bienstock, and I'm a board-certified plastic and reconstructive surgeon. I specialize in home wound care, meaning I take care of people in their own house if they have wounds such as pressure ulcers when they can't go to a doctor's office due to physical limitations. So it's not uncommon when someone comes out of the hospital or they deteriorate due to dementia or other neurologic conditions that they lose the ability to go to the bathroom by themselves, which means they're incontinent. This can happen both with urine and feces, or poop as my daughter likes to call it. So what do you do in these scenarios? It's really important to manage that because you don't want urine and feces touching the skin for various reasons. Number one, this can make wounds worse because you're getting fecal contamination or bacteria from the poop, which can get into the wound, which can lead to a wound infection, as well as urine can irritate the skin and lead to a fungal rash or other skin irritation. So how do you manage this? So a lot of people run to put in what we call catheters, which go right into the bladder itself. This is something I don't recommend unless the person really cannot void or urinate. The more important thing is to really see if you can come up with both a urinary regimen as well as a bowel prep regimen to see if you can manage this, which means that they may be able to urinate at certain times of day or poop, and you can control this so it doesn't linger in a diaper. Most of my patients who are bedbound or have decreased ambulation that require diapers and can't go on their own have diapers. The pull-up ones are not very good. I like the tab ones that you'll see kids have, but there's obviously an adult version of this. The reason is you can have the diaper on and air it out when they're in the bed, as well as easier to put on, and they tend to breathe better. So what do you do when your loved one, whether it's a mother, father, grandmother, or aunt or uncle, has incontinence? You have to work with the caregivers as well as everyone else to see how to manage this, which means the diapers have to be changed on a regular basis. I prefer at nighttime to leave the diaper open with what we call disposable pads or chucks so the skin can breathe. When you have poop or urine that touches the skin, it can really irritate the skin, which oftentimes leads to a fungal rash, which can be very debilitating in terms of irritation, pain, as well as rawness, and which can even lead to an open wound. So these are things I recommend in terms of how to manage incontinence. The best thing is to avoid catheters if you can. Obviously, some people cannot void on their own, which means they can't pee on their own, which means it will require either a Foley catheter, which goes inside the bladder, or a suprapubic catheter, which has to be done in the operating theater. Otherwise, I would have the patient wear a diaper and try to see if they can go to the bathroom with assistance with the caregiver. And if this is not possible, particularly at nighttime, to wear diapers, but leave them open so it collects the urine and the feces with chucks underneath. Thank you. Please leave comments below and subscribe to the channel whenever you get a chance.